Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the wax scope. This is a really interesting case. It's of a patient who attended with a really narrow ear canal. And initially I used our medium-sized specular, which has an opening from side to side of the specular, as you can see on screen, of 4.25 millimeters. But just to enter the ear a bit deeper, I used our smaller specular, which is our pediatric specular. And it's got in a diameter of 3.5 millimeters. However, there was only so far I could insert the specular because you can see to the right, that second bend, it was so narrow that even with this small specular, I couldn't enter any further. And this is where narrow ears can become problematic when you use a specular, like with the white scope, or an ENT operating microscope or head loops. With an endoscope, I actually would find it myself a bit easier because I can insert the endoscope past that bend and I can stretch the ear out using the suction probe. But a lot of specialists that we train with an endoscope really struggle with that technique. Hence why, in a way, we've developed the wax scope, because when you have a specular, it is more user-friendly. So for specialists who struggle to use an endoscope, it is, I feel, the wax scope, and that's me being biased, the next best alternative when you compare it especially to loops, because you just don't get the magnification. So this wax is actually impacted on the drum, and they have a really narrow ear, and you'll be quite amazed by how much wax came out. So if you watch till the end of the video, you're going to see a still image and you'll see all this dark wax. Now, what was actually also interesting, this patient has been suffering from headaches for many years, and they were diagnosed with migraine as a result. And progressively, their migraines or the headaches were getting worse and worse, and they're on medication, and that has been increased. But never has their ears been examined, and over the last few weeks, they've been suffering from a lot of pain from this side, and this side of the head in particular. So we know this wax has been there for a long time. You can tell by the colour and just how impacted it is. And this patient doesn't use cotton buds, or at least they assure me they don't. And so for this much wax to come out of this ear, it must have been there for years. Now, what was interesting is after the removal of the wax, they felt that their symptoms, not only the ear symptoms, but that pain around that side of the head, it improved. So it sounds silly, but it may be that their headaches, which they've been diagnosed with a migraine, is due to really severely impacted earwax. Now, it may not be, but just ask the patient to monitor it, because it was such an improvement in their symptoms. And they could hear themselves so much better that when they were speaking, they were pausing a lot because they couldn't believe just how much they were hearing themselves. So again, just taking this off the drum. So yeah, inserting this specular deeper, it's just not possible. So this is where the wax scope is really useful, because it has really high level magnification. So even if the wax is really deep, I can see exactly what I'm doing. And slowly bring this out. And at the end of this procedure, there's some sticky wax on the drum that we remove, and also some hidden wax in the anterior recess. Now, you may be wondering how I'm going to get access into the anterior recess when you've got such a narrow ear, but you will see that we managed to remove it. So I'm just focusing on the top now. The patient's got a few hairs here. Because we can't insert the specular any further, they are going to be slightly in view. With an endoscope, we can potentially, because this wax is deeper, I could glide the endoscope past the hairs so you don't see them on screen. So just getting that wax in focus. You can just see some of the eardrum, top left, there's a blue tinge there. You're going to see it more now. There we are, it's revealing itself. So again, we're taking this directly off the drum. The suction probe only just fits, actually, so it gives you an idea of how narrow the patient's ear canal is. So this wax that I brought away from the eardrum, it's come towards the entrance and it's split in two, so it's just loose in the canal. So I'm just going to mop that up. So I did put some medical grade olive oil spray just to help soften some of this deeper wax. So we're going to see the eardrum. There's a bit of staining now. I decided to get that middle section out. We're going to use a fine end. And you can see the eardrum has got some staining, so this wax was really impacted. There's a bit of residual wax on the floor of the ear canal, and also some anteriorly in the recess. So we're going to now revert to the fine end suction probe. Going to focus on that wax in the middle. We're going to gently take that off the drum. So with the wax scope now, doing much more complex procedures. I uploaded one yesterday, and I've got another few to upload. So we're getting more and more comfortable with it now with complex cases. So just going to gently just hover over. We don't want to make contact with the canal wall. So there is going to be some leftover wax because we don't want to scrape against the canal. So I'm just hovering away, and anything that comes away, brilliant. Anything else, we're just going to leave. So I could have zoomed in as well. We have got a zoom function, but truth be told, I kind of forget about it because I don't often use it. It's not it's because I just don't need it myself, but might have been actually good for this bit. So you can see we're getting stuff from the inferior and anterior recess. We're going to lift this skin up over the isthmus, the narrowing, which is about 0.5 centimetre away from the eardrum. There we are. Just going to look at the eardrum again. There's the hammer bone. You can see all that sticky stuff staining, with that wax being impacted, and you're now going to see all that wax, and that's just come from one ear, so it's quite an incredible amount. You can just see the colour, how dark it is. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.